Hello, everybody, and thank you for following us and participating in our web series questions, and we get a lot of feedback. We really appreciate that. This month, we're going to be talking the basic differences between MRI and CT. Very often we hear, what's better? Which one should I have? And in reality, when is MRI ordered versus CT? Today we'll talk about the basic differences between the two, how they appear, when is one ordered versus the other, and we'll give you a little bit of information about each modality, each scanner, so you can recognize when you see, and when you hear, you'll know what to expect. So Rubik, first of all, we hear so many different names that are given to each MRI and CT. Can you kind of introduce
Absolutely.
them?
Yeah, my pleasure. So we'll start with the MRI. That's actually the real main name, MRI, magnetic resonance imaging. But we also hear sometimes to be called MR, just simple MR. It's the exact same thing, exact same machine, exact same modality. And the second one, CAT scan, CT or CT scan. It's a computer tomography. So again, it's the exact same thing, CT, CAT scan or CT scan. We have a lot of cases where patients kind of get confused, but once you tell them, they realize that it's the exact same thing. It just makes perfect sense for them. As far as the visual differences, or the main differences, I should say, as you can see on your screens, MRI looks like a tunnel, basically, with a smaller, narrower opening, versus when CAT scan, which is right behind us, has a larger opening, and it's donut shape. And another difference is MRI makes loud knocking sounds, no matter what strength MRI it is, even if
The
it's
open ones are a little less,
0.3, exactly. Yeah. Open ones are a little less than the closed ones, but they all have noise, versus CAT scan, where it's quiet, faster. But CAT scan uses X-ray tube, just like your regular X-ray, but uses three-dimensional imaging. Andre will explain us more detail. And MRI actually uses, I think we talked about this in our previous web series, is MRI uses magnets, antenna, and gets the signal from the patient's body water. And now we'll have Andre,
detail
exactly.
maybe. To continue where Rubik left off to now that I can go into a little bit detail between the differences and how they work. Magnetic resonance imaging. There's three things that come together to form an MRI image. Magnetic means the actual magnet itself, which is the machine, the tube that you see itself. Resonance, what that word means is the human body consists of atoms and molecules everywhere, right? And since we take the signal from body water, whenever we introduce that strength, that MRI comes in, that magnet comes into play, certain molecules, certain atoms faces certain direction that the MRI is able to pick up, and with the help of antennas and coils, convert that into an actual image that you see. So there's no X-rays involved. We're not shooting the patient with X-rays or radiation. It's just magnets, body water, and antenna, those three things coming together to form an MRI image. So therefore, it's actually a very safe test to have, except it just takes a lot longer than a CT or an X-ray or an ultrasound would. On the other side, CT is basically on the concept of X-rays. It has an X-ray tube. The only difference is it doesn't have one detector. It has many detectors. And that's why you hear it's a 4-slice CT, 12-slice CT, a 64-slice CT, which is what we have. That just means that it's a lot faster, a lot more powerful, and we're able to scan body parts, let's say the heart. It beats so fast, you can only take a picture when the heart is at rest, and you don't get a lot of time between beats. So your scanner has to be so fast to be able to catch that fractional multi-second that the heart is at rest to be able to take an image. On the other side, which is the negative side, it uses a lot of radiation. It uses X-rays. So when the doctors ordered, they take all that stuff into consideration. One thing that we didn't mention, tomography. What's the word tomography mean? Basically, it means turning the human body into cross sections. The best way I can explain, if you take a loaf of bread and you start slicing it into many different pieces,
Those
and
are
that's
your
what we
images,
do when
yeah.
we do a CAT scan. If it's the abdomen, then we'll take it into however many slices. You know, we can cut it in 3 millimeters, we can cut it in 5 millimeters. It all depends on what we're looking for. So those are the main two differences between MRI CT. One uses radiation, the other doesn't. Well, you know, one uses magnets, and the other one is a lot longer and a lot faster. So
Just wanted to add something. Like
Sure.
we measure the MRI with Tesla's 0.3, 0.5,
Of course, the
1.
strength, yeah.
Exactly. And like you mentioned, that CTs are measured by the slices.
Right.
4, 16, 64.
That's
like
the power.
Andres said, we
Great
have.
point, actually. Yeah.
Bear in mind, when the number, higher the number, lower the radiation. Reason being, the scan is done much faster. You get 64 slices per second rather than 4 slices or 16 slices per second. So if the higher the number, the scan is faster and you get more images in a shorter time.
So why is that good for the patient to take that even further?
well.
When we do a CT, they have to hold their breath while
There we
we're
go.
scanning. So if you only have a 1 or 4 slice CT, let's say when you do a chest, abdomen, pelvis, they may have to hold their breath for 25, 30 seconds.
Yep.
But with we're 64 slice, we can do the same thing in 8 to 9 seconds.
Yep,
That
good
means
point.
great image quality, faster,
Faster
and
scan,
a lot
less
better for the
radiation. Yep.
patient. Those are the difference between the two.
Nice.
And now to cap this off, let's review a little bit. When is MRI ordered versus when is CT ordered?
that's-
Generally, there's exceptions, of course, to the rule.
That's
So-
another question that we always get. Well, for MRI is actually you can do MRI for every body part except where there is air, gas, being lungs, colon, and sinus. Those are the
main ones, pretty much.
ones that you cannot do with MRI. I mean, you can do it, but the image quality is not going to be right.
There's
and the
nothing there
diagnosis
to get a signal
there's
from.
No,
It's
exactly.
all
There's
air
no
and-
water
yeah.
there. There's no water. There's air. Like we said, we get the image from the patient's body water. The lung doesn't have water. Colon doesn't have water, or sinuses don't have water.
Right.
And as far as CT, it's mainly used for digestive system, abdomen, pelvis, colons, lung that we mentioned. Whatever we
Internal
can
organs
do
in
with
general,
internal
yeah.
organs, whatever we can't do on the MRI is actually really good, really well, very well seen on the CT, or in severe emergency cases. If you go to ER, God forbid, from an accident and there's a concussion or a headache, to rule out a brain bleed, that's the first thing they do. They do CAT scan because it's fast, it's diagnostic,
Gives you correct,
and yeah, in like seconds you will know exactly what's going on. Another case, appendicitis, which is a very emergency situation, or basic fractures.
Right. And
Yep.
CT in general is greater for bone work. Let's say they're suspecting a hairline fracture,
Yep.
and that's all they're suspecting, and no tears or anything like
Mm-hmm.
that. They would do a CT as opposed to doing an MRI. But not that MRI won't pick up a fracture, but let's say it's already known the patient has had an MRI, and for some reason, it's not healing, even knowing there's a tear and stuff. They're suspecting a microfracture. So they can go backwards and go into a CT to make sure that the bone is healthy.
Yep.
So,
But on the other hand, you can do MRI in the exact same area to rule out a tear, muscle
Right.
tear. So here we go.
Absolutely.
It comes into play. What's better?
So in a nutshell, that's pretty much what
yeah.
we wanted to cover today.
See, in reality, like everyone asks, what's better? What's a right scan? There is
can't really say,
you
right?
can't say
yeah.
what's better, what's not, what's accurate. It just depends on the situation, time, and the diagnosis, basically.
One more thing I wanted to mention before, like Rubik said, situations. There are people that, not everyone can have an MRI. We'll cover the MR safety in a later web series,
definitely.
but there's people who have pacemakers, can't have an MRI. There's people who have aneurysm clips, they can't have
have it.
MRIs, or have, some kind of metal in their eyes. So CT is a great substitution.
Yep, definitely.
And also, since CT uses radiation, X-rays, the referring doctors will consider the patient's age as well, to make sure that, if MR will be better, save the patient radiation. It all depends risk versus reward.
Yep,
So
that's it.
if you have further questions, please contact us in different formats that you have: Facebook, Instagram, email, and call us. Again, this
YouTube.
was Andre.
And Rubik, stay healthy.
See you guys next month.